Today we're going to be going over text neck, student posture, also known as upper cross syndrome. U for upper cross syndrome.
Upper cross syndrome is a series of muscles where there is weakness in some muscles and tightness in other muscles. So as we see in this picture on the left would be more of a neutral spine, neutral posture. The picture on the right is what we would consider to be upper cross syndrome. The upper cross syndrome tends to have weakness in the deep neck flexors, so that we have weakness in the front of the neck, as well as weakness in the lower traps, serratus anterior, and sometimes even the rhomboids, which are these muscles that attach to the shoulder blade and are in between the shoulder blades as well as under the shoulder blade. And then in contrast, we have tight muscles. Here in the front, we have the tight pectoral muscles right through here. So that pulls the shoulders forward or rolls the shoulders forward. And then tight muscles in the upper traps and levator scapula. So in the back of the neck and into the shoulders, we have tight muscles here. So it's all called upper cross syndrome because there's a cross pattern of tight muscles and a cross pattern of weak muscles. Because of these tight muscles right through here in the pecs, it correlates with the weak muscles in the back, the lower traps and serratus anterior. Same thing, you're going to have the weak muscles in the front is going to be correlating with the tight muscles in the upper back and shoulder area. If we look at this posture picture, we can see that with a neutral or normal posture, the head is about 12 pounds of force going directly down through the spine. For every inch we go forward, so anterior head carriage, you can see 2 inches adds an extra 20 pounds to that head, 3 inches adds an extra 30 pounds to that head. So by adding extra weight to the spine or force that the spine has to hold and support, these muscles tend to tighten up a little bit. And because of the weakness in the front of the neck, those deep neck flexors, the head can translate more and more forward and cause the posture to gradually get worse and worse over time if we don't focus on strengthening some of the weak muscles. So we want to start to strengthen the deep neck flexors, which are the weak ones in the front. We want to start strengthening the rhomboids, serratus anterior, and lower traps in the back. And then we also want to do some stretching or manual muscle therapy to help with the tight muscles. So we want to do some stretching or manual muscle therapy to the pecs, which are tight in the front, as well as the upper trap and levator scap, which is in the neck towards the back, as well as in the shoulders.